Hi, this is Andrea Kane, and I'm here with HIT 292 Healthcare Reimbursement, and we are now on week 9, talking about Chapter 4, Government-Sponsored Healthcare Programs. We are still using the same course objectives and unit objectives from last week, so take a look at your syllabus if you are questioning what those are. But our learning objectives from the book for this week are to identify the different government-sponsored healthcare programs, talk about the history of Medicare and Medicaid, and describe the effect that these government-sponsored healthcare programs have on the U.S. healthcare system, because they do. They are the majority of what is going on here in the U.S. Medicare was started really through the Social Security Act in 1965. It really targeted beneficiaries who were age 65 or older who were eligible for Social Security or Railroad Retirement benefits. Notice that they were eligible for Social Security, which means they had worked, or they were someone who was married to or child of someone who worked, who was 65 or older, or had that Railroad Retirement benefit. They were persons who might have a permanent disability, so they could either be age 65 or older, or they could be under 65 but have a permanent disability, or they could have end-stage renal disease, ESRD, which means they were on dialysis. There are 4 parts to Medicare, and you're going to want to make sure you memorize these 4 parts, okay? Hint, hint, hint for your quiz. Memorize these 4 parts. And really, you just need to know these in general. There's hospital insurance, Part A. That's all inpatient based. It also includes hospice, I believe. Part B is called voluntary supplemental medical insurance, and that's everything outpatient ambulatory. Then you have Part C, which is a managed care option, and it covers parts A and B together. So A and B, A plus B equals C, literally in this case. A plus B equals C. C is a managed care option. That may be an HMO, a PPO, or who knows. We'll talk about that next week, week 10, in managed care plans, but that is what that is. So Part C is the managed care option that combines Part A and Part B. Part D is prescription drug coverage. So make sure you know those. All right, so let's talk about Part A. It's hospitalization insurance. It's inpatient, and it's provided with no premiums. There is a cost sharing that includes a deductible, co-payments, and co-insurance. It includes acute care inpatient, as well as long-term care, skilled nursing facility, hospice. So you want to think of that as your major medical, so to speak. Part B is voluntary supplemental insurance. You have to pay a premium to purchase. That's why it's called voluntary. It does have, just like the Part A, it has cost sharing, deductible, co-payments, co-insurance. But this includes all the outpatient things in life. Physician services, ED, urgent care, outpatient rehab, all of those types of things, including medical supplies, DME, durable medical equipment, and medical supplies. Part C is Medicare Advantage, and that's that managed care piece. And it does require a premium, may have cost-sharing provisions depending on the plan that's selected by the beneficiary. It has an expanded scope of services, including custodial care, dental services, vision services, health and wellness services, hearing aids. So you want to make sure you know all these things. All right, Part D is that prescription drug benefit. And it is administered by prescription drug plans and Medicare Advantage plans. There is a premium, a deductible, and co-payments as applicable. Medigap. Medigap is a supplementary insurance to cover items and services that are not covered by Medicare, and it's offered by various insurance providers. If you have ever watched television during the daytime, you have probably seen Medigap insurance provider commercials. They're out there to tell you about how this has really helped people and all that sort of thing, and it does. Don't get me wrong, it does. But they have to meet federal guidelines and provide. And a Medigap plan is really a great idea if someone can afford it. What is Medicaid? Talking about affording. Medicaid was part of the Social Security Act of 1965. It really was targeted to individuals and families with very low incomes, essentially the poor. It is a joint program between the federal government and the states. So Medicare is federal government only. Make sure you know that. Medicare is federal government only. Medicaid is federal government and states. The federal pays a part of it and the states pick up the rest. It's also administered by individual states, which means it varies state to state to state. So you need to be aware of that. So that's how Medicaid can end up being a managed care option, is because it's handled by the different states. Medicaid requirements, it covers poverty-related infants, children, and pregnant women, low-income families, families receiving transitional medical assistance, children with the adoption assistance, foster care, guardianship care, children aging out of foster care, elderly and disabled individuals who receive Social Security incomes, aged, blind, and disabled individuals who live in 209B states, some working individuals with disabilities, and then some that are low-income Medicare enrollees. And the example they give us are those of specified low-income Medicare beneficiary. So Medicaid is really targeted to those who don't have any other recourse for insurance. So think of it that way. Individuals who have no option for any other insurance, that's what Medicaid is for. PACE is the program of all-inclusive care for the elderly. It's a joint Medicare-Medicaid venture. It offers states the option of creating and administering a managed care option for the frail elderly population in the community. And it's really looking at those who live in their own homes and have service facilities in various geographical service areas. So they're trying to increase accessibility of healthcare to very frail elderly population who are also very poor. CHIP. CHIP is the Children's Health Insurance Program. It's a state-federal partnership, again, part of Medicaid, that targets the growing number of children not covered by health insurance. CHIP is different than Medicaid, but like Medicaid, it varies from state to state based on the state. And CHIP says these certain services have to be provided, and it also limits cost sharing provisions. There are currently estimated to be about 9 million children enrolled in CHIP. TRICARE. Okay, now we're getting into the military. Anytime you see TRICARE, you want to think military. This is for active duty members of the military and qualified family members. It also includes activated, notice that word, activated Guard or Reserve members. They have to be activated to be covered under TRICARE. Comprehensive coverage, it's everything. They have the whole 9 yards when you're talking about TRICARE. There are all of these nice TRICARE options. And I would say the thing that you most need to remember are these two up here, up in the top right corner, these two acronyms, ADSM, Active Duty Service Member, and ADFM, Active Duty Family Member, because that will help you as you go through these different programs. TRICARE Prime and Prime Remote is for both. And then the rest of those will go through, you can go through and see what they cover. And again, not fun to memorize, but probably worthwhile if you're going to be going into anything that really focuses on insurance. VA, we've all heard of Veterans Health Administration, or the VA. It is the nation's largest integrated healthcare system. There are over 1,700 care sites, and I would encourage you to take a look and see what's out there in terms of Iowa, because hint, hint, at some point you will have an assignment to look at all the VA facilities in Iowa in the HIT program. And the VA serves over 8.7 million veterans. They try to do this at little or no cost to the members, and private insurance can be used to supplement VA benefits. All right, CHAMP VA. What is CHAMP VA? It's Civilian Health and Medical Program of the Department of Veterans Affairs. This CHAMP VA covers dependents and survivors of permanently and totally disabled veterans, survivors of veterans who died of service-related conditions, and survivors of military personnel who died in the line of duty. So if a family member qualifies for TRICARE, they can't enroll in CHAMP VA. But if they don't qualify for TRICARE, then CHAMP VA is sort of the safety net that covers them. And they can be treated at participating VA facilities. There are some deductibles, especially on the outpatient side, as well as some cost sharing. Make sure you know the difference between CHAMP VA and TRICARE. Indian Health Service is another government program. It covers American Indians and Alaska Natives. There are clinics, there are hospitals, ambulatory care, providers, community health services, rehab services, preventative health services. Workers' comp is another one. Now, workers' comp varies state to state. So it's important to know that even though there's a federal mandate for this, it's really state-based. It looks at anyone with a work-related injury, covers their health care costs, income loss. It's legislated again by the individual states, so there's set coverage, and it covers burial, death, income, and medical. The Federal Employees Compensation Act is for federal government employees, and it was established in 1916. So this covers people like postal workers. It also covers, like people who work in government positions that are non-military. They may work at the Pentagon, they may work at the White House, they may work other places, but they're paid, they're government employees. They may even work for the IRS, but they're non-military, and so that's where they're covered. All right, well, that went by pretty quick, a nice short one. So you will have a discussion this week, your case study assignment, and the quiz. I hope you're having a good week. Hard to believe that we are almost to the end of October. Where has the time gone? Well, anyway, take care, and I will talk to you again next week.